Good evening, everybody. My name is Casey Ulrich, and on behalf of the National Nurse-Led Care Consortium, I would like to welcome you to today's webinar, Practice Transformation for California. Today's webinar is being recorded and will be available in the upcoming week on our Nurse Practitioner Support and Alignment portal page, and a link to the recording will be sent out to all registrants. All participants will be muted throughout the presentation. I encourage you to submit a question throughout the presentation. Please use the Questions tab on your GoToWebinar control panel as seen in the picture on your screen. And the questions will be relayed to our presenters at the end of the webinar. A survey will pop up at the end of the webinar and be sent in an email later today. Please take a few minutes to complete this survey evaluating this evening's activity, as your feedback is critical to the ongoing development and presentation of our webinars. The slide for today's webinar is available. The slides are available as a handout, which you can access via the Handouts pane of your GoToWebinar control panel. It's the PDF that says Practice Transformation for Colorado. You can click on the name of the handout and it will download via your default web browser. If you have questions or issues during the course of the webinar, again, you can use the chat function or use the question function. If you have your another question for the Q&A portion and you would like to speak with the presenters, you can raise your hand using the hand icon. And we'll get back to you during the Q&A portion for you to answer that question. Today's presenters are Gail Armstrong of the University of Colorado College of Nursing Practice Transformation Network, and we also have Karen Zink of Southwest Women's Health Associates, also located in Colorado. The University of Colorado's Practice Transformation Network provides thousands of clinicians in the state with health IT training, practice coaching, and regional learning collaboratives to help them transform their practices and succeed in a value-based payment environment. Clinicians and their practices enroll for free and receive training around payment reform, creation of care teams, use of data to improve care, and more. The Colorado Practice Transformation Network is still recruiting and wants to enroll nurse practitioners and nurse-led practices from the state of Colorado. So for those of you who are attending from Colorado, definitely please take note. Southwest Women's Health Associates has enrolled with the Colorado Practice Transformation Network to receive technical assistance and training services. Founded in 1989, this nurse-led practice is a leader in women's health, and Karen Zink, the owner of the practice and one of the founders, will talk about how the TCPI program will support her practice and why she thinks other NPs should consider joining as well. So I'd like to thank Gail and Karen for joining us today, and to the rest of you for spending a little time with us this evening. Before I hand it over to them, I would like to take a moment to tell you about my organization, NNCC, as well as the Transforming Clinical Practice Initiative. So the National Nurse-Led Care Consortium is a membership organization with over 250 nurse-led practices on its membership roster. Its mission is to advance nurse-led care through policy, consultation, and programs to reduce health disparities and meet people's primary care and wellness needs. Our partner in our project is the American Association of Nurse Practitioners. It's the largest full-service national professional membership organization for nurse practitioners of all specialties. And it's leading the way in advocacy, continuing education, and professional development for over 60,000 members. So as I mentioned, NNCC and AANP are partners with a grant from CMS to support the Transforming Clinical Practice Initiative. This initiative is CMS's largest ever investment in practice transformation, about over $700 million in funding, and they hope that over the course of its 4-year program, it'll reach over 150,000 clinicians. So CMS funded NNCC and AANP to support enrollment of nurse practitioners into practice transformation networks and to develop nurse practitioner specific educational material that helps facilitate practice transformation. NNCC and AANP are the only nursing-focused grantees of the TCPI project. We entered into this project because we think it is critical that nurse practitioners receive the support they need to remain competitive in a changing healthcare landscape. So we all agree that NPs are the future of primary care in the United States and already provide high quality and cost-effective care. This TCPI initiative is an opportunity for NPs to prove it by helping CMS and the broader healthcare community build the evidence base for practice transformation, while at the same time receiving services to help them prepare for a value-based reimbursement environment. And you'll see on the screen just a little bit about the TCPI project. There are 29 funded networks across the country. Today, of course, we have Gail Armstrong from Colorado's Practice Transformation Network. If you're joining us from another state or another region, thank you very much for coming. There are other networks that are active in your area, so I encourage you to stay on the line and learn a little bit about the program. While Gail's Colorado Practice Transformation Network is unique, many of the services across the Practice Transformation Networks are similar, so there is a lot to learn from hearing about her presentation and the services that they're providing. So CMS is not putting out $700 million out of the goodness of their own hearts. This program is really here to help prepare clinicians across the country for payment reform, and in particular, payment reform under MACRA. So you've probably heard a little bit about MACRA. It's the Medicare Medicare and CHIP Reauthorization Act is what the MACRA acronym stands for. It's a piece of legislation, and it was passed that establishes Medicare's quality payment program. While the quality payment program has not been finalized yet, it's important to know that it sets into place mechanisms to adjust Medicare Part B payments to incentivize quality, and it does that through two programs, the MIPS and the Advanced APMs programs. Most clinicians out there will end up associated with the MIPS program. And again, the details of this I don't want to get too much into because it hasn't been finalized and we don't know if it applies to you and your practice yet. However, we do think the general trend is important to pay attention to. The Medicare Quality Payment Program focuses on 4 things clinicians and their practices need to do to be successful in a value-based reimbursement environment. That is, report on the quality of care that's being delivered, report on the quantity of care that is being delivered, and that's the sort of fee-for-service element that will never go away. Report on the quality improvement activities that your practice is engaged in, and use Health IT to support quality and report results. And that's sort of the meaningful use element. So if you've been involved in the Medicare or your state's Medicaid meaningful use EHR incentive program, that's kind of where that comes through. We believe that these 4 elements are critical to succeed in a value-based payment environment. So even if the particular MACRA MIPS program does not apply to you, we do know that state Medicaid and private payers often follow CMS's lead when it comes to to quality payment programs. So we think that for clinicians that are out there, if you can successfully engage in these 4 activities, you will be in a good place to succeed in a value-based reimbursement environment. And the TCPI and the practice transformation networks like Gail's Colorado PTN exist to help clinicians develop the skills and resources that are necessary to succeed in a value-based reimbursement environment like this. So we think that it's critical that nurse practitioners have a leadership role in this Transforming Clinical Practice initiative. We believe that nurse practitioners are already a large and growing part of the delivery of healthcare in the United States, especially primary care. here at NNCC and with our partners at AANP, we want to connect nurse practitioners to these TCPI-funded practice transformation networks, and they provide their enrolled clinicians with things like peer-based learning networks, and they have the responsibility for enrolling clinicians and their practices. They provide the boots-on-the-ground technical assistance services to help practices realize practice transformation and prepare for value-based reimbursement. We think nurse practitioners can help practice transformation networks by serving as leaders within their networks. Many aspects of the TCPI change package align with nurse-led care, and that includes things like engagement with the community, working with the patient as a member of their own care, developing care teams, and providing enhanced access in terms of off hours and that sort of thing. And then in turn, the practice transformation networks can provide nurse practitioners and nurse-led health centers with critical resources. So again, free quality coaching, population health management tools, support for health IT services, and then also access to a larger network of clinical peers who are all engaged in the same programs and working towards the same goals. So, how to get involved with the TCPI? Again, NNCC and AANP have received this grant and are partnering to make sure that nurse practitioners are connected to TCPI-funded networks in their area. So we're conducting outreach and education across the country to let nurse practitioners know about this important initiative, and we can provide referral and linkage services to nurse practitioners to connect them to networks that match their needs. So we can find a network that has the correct geographic and population focus, the right mix of technical assistance and training services, and the right quality improvement focus. So I'd say if you want to get involved, you can start off by going to the website that we've set up on AANP's site to learn more about the TCPI and our Nurse Practitioner Support and Alignment Network. I'd also encourage you to go to the healthcarecommunities.org TCPI portal page, create an account there, and learn about the TCPI, join our NPSAN portal page, and you'll receive updates about free events like this one, as well as access to continuing education. And then finally, you know, if you are looking for a network and know you want to get involved, you can reach out to us directly. My colleague Chantel DePape from AANP, her email's there, as well as my colleague here at NNCC, Tiffany Depew. So there's really no wrong door. And again, remember that there are no fees to participate with the TCPI or practice transformation networks. So thanks for letting me give you a kind of overview of the TCPI and why we believe it's important that nurse practitioners participate in this program. I'm going to now turn it over to Gail Armstrong from the University of Colorado College of Nursing. I'll give her control of the slides now. Gail's going to provide you with an overview of how their practice transformation network in Colorado is helping NPs transform their practices ahead of payment reform. So Gail, it's all yours.
Thanks, Casey. It's good to be with you and the attendees this evening. Just a little bit about my background. I'm an associate professor at the University of Colorado, and my work in quality and safety has been in quality and safety nurse-led initiatives in the acute care setting. I'm a clinical nurse specialist, and so moving into TCPI was a bit of a shift of moving out of acute care and into primary practice and specialty practice, but the concepts of quality and safety and practice improvement actually have translated really well. And the goal of my slides and my next about 10 minutes with you is just to give you an overview of Colorado's approach to practice transformation and how we are interacting and interfacing with a wide variety of practices within Colorado. I'll tell you, we feel, the faculty of our practice transformation team feel like we're still in kind of the beginning phases of this. So I'll make a few comments along the way that we're still figuring some components out, but I hope to give you an idea of how we've approached this opportunity thus far. One of the realities we know is that there's just a lot of demand in practices, and that sometimes you can be so busy that you resist the change until you absolutely have to make the change. And the spirit of TCPI is to start improving and updating your practice before the really big changes are implemented in 19. So to try to avoid that 12th hour crisis that we know a fair number of practices will be caught in. We also are very realistic that there's a lot of competing demands in healthcare right now. And so we are working really hard when we enroll a practice to have TCPI be an element of their practice that's helpful and supports other changes, and is not just an extra layer of something to do, another demand, another thing to kind of burn out providers, because we know that that's a problem. So within Colorado, our goal is to get providers and practices ready for value-based compensation models. Our goal is to enroll 2,000 clinicians for our 4-year model, and we're actually pretty close. I was saying to one of our panelists that we're probably about 100 providers away from our goal. But we would really, really welcome more nurse practitioner-led practices. So if anybody in the audience is interested in enrolling, I have my contact information on the last slide. Don't hesitate to contact either me or Casey. But the goal is really to improve clinical quality measures, which is very similar to another initiative called State Innovations Model, the SIM model some of you may be familiar with, to help practices with their resource or utilization measures. Those are just a few examples: hospitalizations, readmissions. And the goal ultimately is to have 75% of enrolled clinicians participate in the value-based compensation by 19. And again, the spirit of this CMS initiative is to provide support to practices and relevant tools to help practices modify what needs to be modified before the new models are implemented. You know, we want practices to feel like they are thriving under the new model, and to help what we're doing within our modules. We have faculty modules that we are developing as practices ask for certain areas of support. And it's really to help practices adapt their policies and their processes gradually instead of dramatically. One common area we're seeing practices ask for help with is management of data. So that's a huge area that I'll talk a little bit more about. Casey mentioned MACRA, and it's going to impact everybody, and MACRA is really the driver behind TCPI being created. Just a little bit of facts about it. It stands for, like Casey said, the Medicare Access and CHIPS Act, passed in 2015 to replace the Sustainable Growth Rate model, which actually was going to result in some cuts to providers. And so MACRA replaces that. The goal really is that 16 through 19 to have an increase in provider payments, and then eventually by 20 to 25 have practices choose which model they want to participate in. And again, Casey mentioned the merit-based incentive payment, also known as MIPS. The other model is the alternative payment models, or the APMs, and there is a fair amount of conjecture that most practices will want to fall under the MIPS model, which again, as Casey went over very clearly, has 4 foci of quality performance measures, resource use measures, improvement measures, and then data or EHR measures. So we in Colorado, we're reaching out to primary practices and specialty practices and pediatric practices. Anybody who's not had help in transitioning to a patient-centered medical home model, that would be a really great practice for us to help because we have a lot of resources about that. And again, trying to help practices get ready for the changes that are coming. We're working with support and alignment networks. Casey's National Nurse-Led Care Consortium is one of our SANs. Just some of the other ones are ACP, American College of Physicians. AANP is a SAN we're working with. And then Colorado is one of 29 practice transformation networks. And the model or the structure is that there is an in-practice support person that's a facilitator. There is faculty support. So for example, I am on the Colorado TCPI faculty, and I provide, along with the rest of the faculty, we provide education to practices or learning networks on an as-needed basis. So as practices hit bumps in the road, we can provide materials, resources, tools, either directly or through the facilitator. And we're also trying to use a learning network model where we cluster practices together, either based on geography or common concerns or common areas of improvement that they want to address. But we think that there's a lot of value in kind of clustering practices that can learn from each other. And then any participating practice has access to tools from all of the support and alignment network organizations, and the faculty and the facilitators help coordinate that so the practices aren't overwhelmed. Just kind of an overview of our general categories within Colorado. We have some kind of fundamental areas where we do a baseline assessment. We have a change package that has gone through several iterations through CMS. It's actually a really great change package. We have some leadership training. Every practice that enrolls in our Colorado TCPI initiative identifies 2 champions, and one is a provider and one is a staff member. And those champions attend some training, either virtually or face-to-face, and they also will be translating some of the processes from TCPI back to the practice. So they need to be 2 pretty highly engaged people with the practice. And we have a learning community set up and kickoff event that we're actually almost done organizing. And then just in data optimization, we're looking at just some of these general areas of claims and clinical data and how to extract data and how to look at risk stratification within your practice. For internal care coordination, we're helping practices look at maximization of care management, communication issues within the practice, transitions of care between settings, some shared care plans, and then focusing external to the medical neighborhood, like care compacts and how we're using telehealth and e-consults. And so this is just kind of a gross overview of some of how we've looked at the processes within TCPI. And when we're recruiting a practice, we kind of identify that change is definitely coming, and practices really have an opportunity to either tap into this really vibrant network through TCPI, where you'll get a lot of support and a lot of access to up-to-date tools and relevant tools and resources, or practices can choose to kind of hire a consultant or kind of figure it out on your own when the changes come. It's a 4-year program in Colorado. Like I said, we feel like we're still in the launching phase because we started in 2016. Any practice that enrolls will start with an assessment where we'll look at current performance data. And that 4th bullet is a really, really important one. The create a plan goals for practice. One of the key elements that Colorado did in applying to be a TCPI center was our model works with the existing practice goals or the existing practice priorities. Again, I said in the beginning, we're really, really clear that providers are stretched and stressed, and so we don't want TCPI to be another layer. We want to work within the needs of the practice, the current goals of the practice, the current priorities of the practice. And we have found thus far in doing assessments or practice assessments with our enrolled practices that almost every practice, what they've identified as a priority or a goal fits somewhere within those 4 categories that Casey and I talked about in terms of the new payment model. You'll also connect with other practices to kind of learn from them and provide some assistance about what you've learned in your own improvement and growth. You'll be using vetted tools from our SANs, from CMS, and then you'll report on your progress, and we'll be collecting data at the state level. So you'll get a practice facilitator, you'll select your champions, and then participate in a variety of learning opportunities. There'll be a learning network kind of virtual meeting that'll happen every month. You'll be submitting your data to our Colorado Data Hub. Again, so we'll look at state level outcomes, and then there'll be some opportunities to do some face-to-face learning with people, with practices in your network and other practices. And I just want to emphasize that thus far, in interacting with some NP-led practices, I'm really struck by how nurse practitioners really are very, very well suited to be leaders in this transformational kind of wave of initiatives that's been happening for the last few years. Nurse practitioners naturally focus on the patient. Your education and training included patient-centered models. These are not stretches for you, so you're really a natural fit. I think nurse practitioners are trained to look at value-based care in terms of patient priorities. Again, those are some of the elements in the new model, the value-based care. Nurse practitioners naturally engage with the larger community. And so there's just, I think, elements of how NPs provide care that are very congruent with some of the goals for the new model. Just an overview, we started in 2016, we're ending our enrollment phase, and we'll be working with practices for the next 3.5 years, trying to facilitate what I said earlier, that we want practices to thrive within TCPI, so that when new models are implemented, you are very, very ready. We have a few primary drivers which can be looked at in terms of performance, quality, and success. Our secondary drivers really are where we're focusing with practices. Looking at team-based relationships, how does care happen in your practice? Where are your workflow efficiencies and your workflow inefficiencies in terms of team-based care? How are you coordinating care between settings, between practices? How do you implement EBP into your practice? Do you have a process, a standardized approach to that? The whole area of patient and family engagement, how do you facilitate it? How do you measure it? What outcomes are impacted by patient and family engagement within your practice? And then all the questions about access, which, given that a lot of Colorado is rural, is a really important question to collect data on and focus on. We're also looking at the balance of a commitment to culture of improvement, but how that's facilitated within a practice without interrupting the flow and function of care. If a practice is continually in an improvement mode, it can lack stability. So how is that balanced through engaged leadership? Just QI and a culture of quality, how is that manifesting your practice? Through what processes, through what data, and what outcomes are you impacting? Practices approach to population management can be different depending upon the focus of the practice, if it's a specialty practice, and the location of the practice. And then health information technology, I've mentioned a little bit. We are finding a lot of the practices that have enrolled have asked us a lot about meaningful use, about mining data, about utilization of health information technology and reporting of these data. And our last secondary drivers are strategic use of practice revenue. So how do you track that? How do you alter that based on emerging needs within your practice and within your larger community? How do you analyze and document value, and what is value? How is value translated within your practice given your patient population? And then practice efficiencies. So we use a change package that has been developed by national experts, and it's gone through many iterations. I have to say the last iteration that I've seen is it's got some really, really good elements that are applicable to a wide variety of practices. We use a PAT, or a practice assessment tool, when you enroll, and that gives us a really wide variety of data about the current state of your practice, and helps us dive into where your areas are for maximal improvement, and where you want to go. And I've mentioned these faculty modules a couple times. The faculty is comprised of advanced practice nurses and physicians and process improvement experts, a lot of whom are associated with the university, and we are developing modules that are virtually available for practices and learning networks based on what the identified needs are. So these are not pre-canned or pre-prepared modules. These are modules that we're putting together based on very specific requests. And I would say, because we're still enrolling, I don't have specific data, but I can tell you we had a practice enroll recently. I went out to with the facilitator to facilitate the practice assessment tool, and by the end of the completion of it, there was a tremendous amount of value for the practice for kind of knowing where they were at and being more clear in where they needed to go. And because the 4 categories of the TCPI initiative are targeted for the new payment model, there was just a real sense of kind of excitement within this practice of like, let's get going. We now know where we need to improve. We know where our weak areas are. We kind of had a sense of them before, but there was real excitement in this practice of like, this is going to be work that gets us ready and helps us avoid that 12th hour crisis. So this is just our faculty team. We have our project leader is Barbara Martin, who's a family nurse practitioner. She's phenomenal. She's incredible. And then we have physicians and process improvement experts that are also on our faculty. And the picture on the right was our very, very boiled down version to what our Colorado TCPI process is going to look like. And the reason I put it on this slide is that we had gone from multiple whiteboards with about 6 colors, and you know, it was a really, really crazy conceptual model of what we were doing, and we finally got it boiled down to a very clean and clear process. So we're pretty excited in Colorado about our TCPI work, and again, thanks for letting me kind of be with you this evening and just tell you a little bit about where we're at and where we're going.
Thanks a lot, Gail. I appreciate that. So Gail gave a bit of an overview of the Colorado Practice Transformation Network, the services that they're providing, and I want to throw it over just for a quick moment to Karen Zink, the nurse practitioner herself and founder and owner of Southwest Women's Health Alliance, to talk about why her practice decided to enroll with Gail's Colorado Practice Transformation Networks and how she thinks that this TCPI program can support her practice going forward. So, Karen?
Thank you, Casey, and thank you for the opportunity to let me serve on your panel. Our practice is pretty mature. When we started our intake process for TCPI, we found that we had seen 4,200 different patients over the last 2 years. So we have a pretty large practice. There are 8 of us, 3 nurses, 3 nurse practitioners, 2 front office staff, and then we have a billing company. And we run pretty lean, so we're well motivated to meet the metrics that are coming our way, but we don't have the guidance that we need to do it. And we really appreciate the guidance that we're receiving, the fact that we will have a coach, and we don't have the internal resources to know exactly what we need to do, and the target has been moving. So we've tried to research on our own how to do certain things or come up with the reporting for certain metrics, and then the metric itself changes. So when I heard about TCPI, I thought there really is a God, and we're pretty excited about it. So we've done our intake process, and we have a lot of deficiencies, and we're looking forward to receiving help and getting going. We think we're already meeting a lot of the metrics, but we haven't looked at our data and been able to report our data yet.
All right, great. Thank you very much, Karen. And I think a lot of practices are in the same spot where they're doing the work and they're maybe meeting some of the metrics, but in order to thrive in this new payment environment that we're entering, you need to be able to demonstrate it. You need to be able to report on it. You need to be able to talk about the validity of your data, and to get from that point A to point B, that's really where the practice transformation networks come in. So we're now going to just take the remainder of the time for any questions that you might have for Gail about the services that they're providing through the Practice Transformation Network, for me about the TCPI in general and the other networks that are out there, or for Karen about, you know, how the process has gone so far, you know, any agreements that she had to sign, what that official intake looked like, the burden to her practice, things like that. So if you do have a question, you can type it into the question tab on your GoToWebinar control panel, or if you click on the hand icon, you can raise your hand and we'll open up your microphone and you can ask your question in person. So I will give you 1 or 2 minutes to think through that. In the meantime, I wanted to take a quick moment and let you know about our NNCC annual conference for 2016. We'd love to have you join us for Fostering Innovation, Sustaining Transformation, the Future of Nurse-Led Care. It's going to be held November 9th through 11th in Philadelphia. Our annual event convenes thought leaders from across the field of nurse-led care and features workshops, plenary sessions, breakout sessions, and networking opportunities. Participants will identify new innovative programs in the field of nurse-led care, identify new opportunities for expansion of services, and identify major upcoming policy changes in the field of healthcare that will affect nurse-led care and nurse-managed health centers. We're still accepting abstracts for the conference. If you want to submit an abstract, you can download the Call for Abstracts document that's located in the Handouts panel, or you can click on the link here to go to our website, or if you were watching this via Vimeo, you can go to nncc.us and check out our conference page under News and Events. So, without any further ado, we'll go back and see, are there any questions that you have right now for Gail or Karen?
while we're waiting for questions, Casey, this is Karen. I do want to say that the process for enrollment was very streamlined. It didn't take me very long, and the people that we have interacted with so far have been very helpful, friendly, easy to interact with.
Well, that's great. Thank you, Karen. I appreciate that. While people are putting those in, I know one question that we often get is about eligibility. Chantel, I know you're on the line. If you have a chance, do you want to talk a little bit about eligibility for enrollment into PTNs for nurse practitioners in their practices?
Oh, hi, this is Chantel from AANP. Yes, so in terms of eligibility, as long as your practice is not already affiliated with a Medicare Shared Savings Program, which would be like a Pioneer ACO or Accountable Care Organization, you are eligible. And I think it's called the PQRS, has a whole list. So this would be clinicians such as NDs, physician's assistants, and nurse practitioners.
Yeah, so CMS is really, thank you, has cast a wide net here to make it as easy as possible for as many clinicians as possible to enroll. So primary care as well as specialty, those of you working in inpatient as well as outpatient settings. So again, if you're on the call and you're in Colorado, Gail and her network is available. If you are located in a different state, there are 28 other practice transformation networks across the country, and you can reach out to Chantel or Tiffany, or go to our website to get more information. And oops, I'll go back just where that so you can see. There's Chantel's email right there and Tiffany's email. So it doesn't look like we have any questions at this time. So I think we'll just take the time, considering we're here in the evening, to give back to you. And thank you all very much for joining us. Again, when you leave, a survey will pop up. Please take a few moments to fill out. Oh, there actually is one question. Would a pain specialty be eligible? So I believe so, Jacqueline. It's more dependent on you know, whether or not you're a nurse practitioner. So if you are working in a specialty pain clinic, there might be a place for you in a practice transformation network, especially because a lot of what the networks are looking to do is close the loop on the relationship between primary care and specialty care, because we understand that that's really where a lot of the savings come in. Gail, do you have anything to add in terms of you know, specialty practices and their place in your network?
Yeah. Absolutely. In fact, I would welcome an email. My email is on the last slide. Like Casey was saying, so what we're finding with a lot of our specialty practices that have enrolled is not receiving correct referrals is one of the big problems at specialty practices. In fact, we have an endocrinologist on our faculty who is helping to identify some of the themes that are emerging from our specialty practices. So I would say, as you know, as long as you're not in another CMS initiative that makes it impossible to enroll, that absolutely a pain practice would be a great fit for TCPI.
Great, thank you. Yeah, so you know, pain specialty, definitely interested. If you're located in Colorado, you can reach out to Gail directly, or if you're in another state, you can reach out to Tiffany or Chantel, and we can help identify. All right. So going once, going twice, 3 times. Again, thank you all for attending. There will be a survey that pops up, and in the next day, you should also get a link to the archived session of this webinar if you have any colleagues that you'd like to share this with. For downloading the slides, again, if you go to your GoToWebinar control panel on the right-hand side of your screen, there's a section that says Handouts. And if you click on the Practice Transformation for Colorado PDF, it should automatically download into your via your web browser. But again, if you have any questions, if you have any issues with that or problems with that, you can contact us and we'll just send you a copy. And Marie, I saw that you had that question, so we'll follow up afterwards just to make sure you were able to access it and send you a PDF copy. Okay, so again, thank you all for coming out tonight, and have a terrific evening.
You too.
Bye all.
Thank you very much.
Bye-bye.